in lectures where sales presentations were given. And I never really liked them. I discounted most of them because they weren't customized or personalized to the way I like to work. My dad, who was a dentist, told me when I first got out of dental school, don't sell. Don't sell. And he basically said educate. And he said educate your patients. And when you're educating the patients, really believe it. Really believe what you're telling them, which you should anyway. And say it in a very genuine manner because, you know, this is important to you, that you educate the patients exactly as to how you would like to be educated as patients. People don't want to spend money for, you know, like therapy or whatever because or stuff that they can't see or feel. You know, but on some level, this work, you'll be able to function much better, and you have to jump over a little bit of a gap to get there, so you feel better about it. For a moment, if we could rule out the money, would you choose to have it done by me?
Yeah,
that's the
absolutely,
first thing.
yeah.
Okay. Because me personally, we've been together a long time. I feel comfortable, and I would like to provide that service for you. And I think I could do a good service for you. Okay, fine.
So, Doctor, you know, this is much more than I had thought of. The $5,000, I don't know what to say.
Well, first, it's very important. We've been together many years. Is the issue trust in terms of trusting me?
Oh no, I want you to do the work. You have done wonderful work for the years we've been together.
Okay, so then it's a question of the money.
Yeah.
Okay, now, so I understand, and so you're thinking that going to India to have this work done would obviously be cheaper.
Yeah. So, I don't know what to say. I was certainly much more expensive than I thought. The 5,000, I don't know what to say.
Dr. Psyche, we've been together for so many years, so I just need to know right off the bat, I'll be very frank with you, it's not a question of trust.
No, no, I think you are wonderful. I would like you to take care of my teeth. Yeah.
Okay, so it's a question of finances, which I understand. I very much understand. So, if I can make it financially palatable for you, it's not as if you have to come up with a big chunk of money today. What we've done in the past for other patients is I'm able to, let's say we can spread it out over 1 year, and every month I can take $300 or so out of your credit card, so it's automatic, so you don't necessarily have to think about it, and it happens. Would that be better?
Oh yeah, that would be much better. Yes. Yeah. Yeah.
Well, if that's the case, if having an extended time frame for payment works for you, then, and since this problem is not going to get better by itself, and it really should be done rather quickly, I would like to set you up in a couple weeks for 2 hours to get the work done, or at least started, and then we'll have some post-op visits after that. But at least I'll feel comfortable then, because I'll know you're being treated and it's done, and we're committed to a plan. Does that sound okay to you?
Yeah. So in other words, I make an appointment today for 2 weeks, and then we start on the whole procedure.
Yeah.
It makes it so much easier for me. You see, what he has done for me is this. He has taken care of my monetary concerns by offering me a plan that will work for me, that doesn't scare me. He's also covered the trust issue. He's asked if I trust him, and of course I do. He has been my dentist for many years. And the third thing he has done, which is very important, he has closed the deal, which many people don't do. He has asked me specifically for a time to make an appointment, which relieves my mind a great deal. And oftentimes what happens with dentists and other people is they get so far and they don't want to close the deal. And I tell you, as the patient here, I feel so much better that he is going to take care of it and that I have set an appointment with someone I trust.
The issue of trust, for me, boils down to this. When I am discussing a case with a patient, they trust me because they hear something in my voice. And they distrust me because they hear something in my voice. It works that way.
I was thinking about going to India because the procedure we talked about is very expensive, and I could get a vacation out of this, and I could get my teeth done okay. So and I'm confused about this.
Well, I want to say this about going outside the country for dental work. In your case, and this is between you and I, and it's very important because we've been together a long time. The reason for you to go out of the country, is it about trusting me or not trusting me?
No, I would prefer that you do the work because I know you are very good. It is, yeah.
Okay, so it is about the finances.
Yes, it is.
Now, in terms of the finances, I know it's a lot of money. And in many other cases, other patients, I don't expect what we've done, because I don't expect people to come up with all that money at once. It's a lot of money. What I can do for you, and especially since you've been a patient of mine for so long, is break the payments up over a year, even a year and a half, and we'll just take out a certain amount of money from your credit card every month. So you won't even have to think about it.
How do you feel about selling dentistry?
Well, of course I don't like the word because I've been sold used cars, I've been sold cars, and I don't like it. It makes me feel bad that I would become one of them, like a used car salesman.
So in other words, as a dentist, you don't want to be a used car salesman. And every time you sell, you feel like a used car salesman. Ooh! Ooh!
Because I want to be a professional. I didn't think professionals sold cars.
Mm-hmm. And if I said to you this, if I said instead of using the word sell or sales, we use the word educate, how would that make you feel?
Ah, now that makes me feel better.
So if you could educate the patients and actually have them be persuaded by your educational talk, that would be good, wouldn't it?
Well, it would feel much better. And for me, it would be easier to sell.
You see, one of the problems we've noticed is that dentists want to be professional and say, and so the word sales is something that is kind of cloying to them. It is like being a used car salesman, and that is not good. What they like doing is educating. And so if we switch the word sales to education, and not only that, if we switch the word education to marketing, which is really about educating the people so that they make the proper choices about their dental health, would that be acceptable?
That sounds very good.
He's a wonderful dentist. So, as a dentist, do you ever take sales courses?
Well, I've been in classes where these courses were presented, but I never liked them. They just didn't seem to fit me or my personality. My dad was a dentist, and when I first got out of dental school, he said to me, if you're going to be successful, you never have to sell. Never sell. Just be genuine with the patients. Just tell them what they need and tell them what you know is right for them, and they'll hear that in your voice, that you're being truthful, and they'll trust you.
That is wonderful.